Merrick Schaefer. I'm part of the UNICEF Innovation Team out of New York, and of course we look at how changing technologies can help students evolution around the world. For most of you in this room, this is going to be really academic and really basic. UNICEF, for those of you who don't know, is a UN agency. It's not an NGO, it's not a nonprofit. We support children's rights across the whole spectrum of child development, and we work in 186 countries globally, giving us a truly global scope to our operations. We work to support ministries and governments. For example, we provide logistical services. We've got networks of planes, trucks, sometimes donkeys. We also operate on economies of scale. We're known for being one of the world's largest purchasers of vaccines, but we're also the world's largest purchaser of pencils. Today I'm here to talk about one project that our team's worked on the last couple of years. This is a story of our team's work. A Ministry of Health asked us to help analyze and improve malnutrition data collection in a small, rural, English-speaking country of about 14 million people. So the UNICEF Innovation Team partnered with CEPA at Columbia University and the Ministry of Health to look at how these changing technologies can improve malnutrition data collection. And malnutrition data collection is actually really interesting because you only need 4 indicators for it to be very valuable: age, height, weight, and upper arm circumference. So these 4 values, you can get very fringe cases as well as full-on cases. So here's what the process looked like when we showed up. A healthcare worker would write the information down, send it through some sort of postal and courier system to the government. They didn't know what they were writing down or why. They didn't use it themselves to diagnose malnutrition. And this is a common problem for anyone collecting data. Is how do you get data on paper into digital form? And if it's in digital form, how do you analyze it so it's useful for people who can act on it? So this is a common problem that was being faced in this country we're in. So this was in Africa, and so we took advantage of the changing technological landscape. In 1998, there were 2 million phones. In 2010, there's supposed to be 500 million phones with a 60% cell phone penetration rate. We used Rapid SMS, which is an open source framework that we built, and we looked at how the existing systems were in place and tried to build on top of the existing UNICEF working practices. Effectively, we're swapping paper for phones in this case. And you might say, SMS, what can you do with 160 characters? Well, all those 4 malnutrition indicators fit in a single message. You pair that with powerful backend software, and you can do some pretty interesting things. The costs were also low, since you're only really looking at the cost of training and SMS messages. All of the healthcare workers had their own phones, and we just used the phones they had on them. So, the system we put in place ended up looking like this. Instead of using paper, they SMS'd it in, and all of a sudden the data was available real time. It was graphed, and it was mapped, so all of a sudden it was useful immediately to people who wanted to do something with it. Additionally, the data was on the cloud, so now you could see it across the country. Different humanitarian and NGOs could access this data, compare things regionally, and even look at it from a global perspective. And our best idea, actually, the last piece of the project came from one of our developers said, hey, let's send a thank you message back to the people collecting this information. They didn't know why they were collecting it, no one ever thanked them for collecting it. We said, wait a second, instead of sending a thank you message, let's send that plus a diagnosis, since we're already doing the diagnosis on our servers. And so you get this link back to the healthcare worker, empowering them and allowing them to actually treat children, the weekly feeding, monthly feeding, regular checkups. And we turned a data collection tool into a tool that actually improved the lives of children throughout Malawi. Yeah! Woo! So we use this kind of as simple SMS, 160 characters, for all sorts of different purposes: food distribution, malarial benefit distribution, literacy incentives. And of course, technology itself is not the answer. It's only one element of innovation. The real question is, can institutions keep pace? What are the challenges institutions themselves are facing? And if we do have real-time data, what are we going to do with it? And I think as UNICEF, that's the question we have to ask ourselves. So here's some information on this. Of course, you can ask me and any of the other people here, half people in this room probably know about this stuff, where the code is, about the project, there's my Twitter and my email. And looking forward to talking to everyone. Thank you.